Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Well, Brad, today our title is going to be the Schroth method for scoliosis, juvenile kyphosis, and Scheuermann's kyphosis.
Okay, so we get 3 diagnoses, all treated by the same system.
Right, and by the way, if you're new to our channel, please take a second to subscribe to us. We have a subscription button here or here. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
And if we don't do the videos, we'll give them to someone who can, just
And
like
that's
in
what
this.
we're doing today,
Exactly.
right, Brad? We found out we have no expertise in this at all.
Right.
And so we had tried, but we didn't do a very good job. And so when you have one of these issues, one of the scoliosis or kyphosis, you need a trained therapist who's going to work with you, because the particulars of your situation are going to require different approaches.
Right.
And so
Not that we're not trained, but we're not trained in that specific
area,
field.
right. So what we're going to do after this is we got Beth Janssen. She actually graduated a year after I did. We both were graduates of the Mayo School of Health-Related Sciences.
Right over here in Rochester.
Yeah. Is it that way?
I don't know. Minnesota.
Anyway, so she went on and studied the Schroth method from a guy in Europe, a doctor in Europe.
Okay.
And she came back to the United States, and now she's opened a clinic. I believe she opened the clinic in Stevens Point, and there's also one in San Jose, California.
Okay. In Stevens Point, that's 30 miles from where I was born and raised. So
Where my daughter went to school for for speech therapy.
these people don't care about that.
They
Bob.
do too. They want to know about our lives.
Sure.
All right. What we're also going to have below is a lot of references that you can look up. I want you to look at also, especially the one that says it's the Schroth Barcelona Institute.com, because what that'll give you is a list of therapists by state who can treat these type of things. So you don't have to be in Stevens Point or in California to get treatment.
Sure.
You just have to look up to find one of these therapists who's trained in this Schroth method.
Right, and hopefully there'll be one not too far from where you live, and you can get the proper
you
treatment.
get the treatment, right. So thanks, Beth, for providing us with this, and she'll give an introduction to the method.
All right, and maybe I'll see you around Stevens Point sometime.
Yeah. All right, thanks.
I'll go there and visit.
All right, sounds good.
Hi, I'm Beth Janssen, a physical therapist from Scoliosis Rehab in Stevens Point, Wisconsin. First of all, I want to take a moment to thank Bob and Brad, the most famous PTs on the internet, for allowing me to speak about one of my passions, the use of physical therapy, scoliosis-specific exercises, to help people with scoliosis. The main method that I use is the Schroth method. It was started in the 1920s in Germany by a woman who had scoliosis, Katharina Schroth. She noticed the asymmetries in her body, and she put herself in a room full of mirrors and tried to move her body around to bring more balance and symmetry to her body. Once she found the most symmetrical position in 3D that she could, she worked on strengthening exercises. She was later joined by her daughter and grandson in developing this method. The method spread throughout Europe, specifically to Barcelona, and Dr. Manuel Rigo is an MD in Barcelona, Spain, who has done a lot of work in developing this method. This method is used for people with structural scoliosis. Historically, it was used mostly for people with idiopathic scoliosis and adults with idiopathic scoliosis. It can also be used with people with congenital scoliosis with some adaptations. Idiopathic scoliosis is a complex, three-dimensional deformity of the spine and trunk. It happens in healthy children and can progress related to multiple factors, especially times of rapid growth and also later on in life. So we use this 3D postural correction and then strengthen the body in the new corrected posture. The intensity of the exercises and intervention is based on the risk of progression. The greatest time for the risk of progression is when someone enters their adolescent growth spurt. That's why many children, when they reach adolescence, are braced for several years. We recommend a certain brace, which is a hypercorrective brace based on Rigo-Chenot principles, and at the end of this you'll see some references where you can look things up. We recommend that the treatment for idiopathic scoliosis is done by a treatment team. It should involve the patient, the family, a physician, a physical therapist, an orthotist if needed, and perhaps because of the stress it puts on the family, some family counseling. These methods, this method and scoliosis-specific exercises are enjoying recently some really good research. So if you want to learn more about the specifics of these scoliosis-specific exercises, I invite you to look at the open access scientific journal called Scoliosis and Spinal Disorders. Educate yourself about this and get the best care for your family. Thank you.